हेलो, यस, ओके ओके। रमेश जी आइए। पांडे सर आप साहब तरफ, और रमेश जी फूलों के बुक की स्वागत करेंगे डॉक्टर प्रकाश पुरी साहब को। जाइए कुलकर्णी साहब। सर एक मिनट। थैंक यू। पांडे जी पुराने आदमी हैं, स्वागत करेंगे सर। थैंक यू पांडे जी। पांडे जी बैठिए, बढ़ जा आगे आगे नहीं। तो नमस्कार, गुड आफ्टरनून टू ऑल ऑफ यू। अभी सुरक्षा प्रतिज्ञा के लिए तैयार हो जाइए आप लोग। सेफ्टी प्लीज प्लीज, सब कुछ खड़े हो जाइए आप लोग। आज के दिन मैं सत्यनिष्ठा पूर्वक से प्रतिज्ञा करता हूं, मैं पुनः अपने आप को सुरक्षा, स्वास्थ्य एवं पर्यावरण के बचाव के प्रति समर्पित करूंगा और नियमों, विनियमों एवं कार्यविधियों के पालन हेतु यथाशक्ति प्रयत्न करूंगा और निश्चित रूप से इन लक्ष्यों को प्राप्त करने के लिए प्रेरणादायक अभिवृत्तियों एवं आदतों का विकास करूंगा। मेरी यह पूर्ण रूप से मान्यता है कि दुर्घटनाएं और बीमारियां अर्थव्यवस्था को दुर्बल बनाती है तथा यह विकलांग एवं स्वास्थ्य के लिए हानिकारक है एवं संपत्ति की क्षति, सामाजिक कष्ट और पर्यावरण के निष्कृष्ट होने का कारण बनती है। मैं अपने परिवार, संगठन, समाज एवं राष्ट्र के हित में इन दुर्घटनाओं, बीमारियों की रोकथाम और पर्यावरण के बचाव के प्रति हर संभव प्रयत्न करूंगा। थैंक यू। बहुत बढ़िया बोला, वेरी गुड। बट सब बोला, वेरी गुड। बट सब ऑनरेबल श्री MP टोटवाल जी, ज्वाइंट डायरेक्टर डिस पालघर डिवीजन, टीमा मिस्टर प्रेसिडेंट DK रावत जी, representative from various industries, organizer of this great function, ladies and gentlemen, I am very much pleased to congratulate to you, your family and beloved children for sparing your most valuable time, and beloved children for sparing your most valuable time to attend this great function on holy ground of Tima. Today, lecture on work permit system, health hazards, faculty Dr. Parag Kulkarni, Ashirwad Hospital, Boisar. Ladies and gentlemen, his interests were in gynecologist. He had to take MS General Surgery for postgraduate, during which he did residency at prestigious Tata Memorial Hospital, Mumbai. After completion of successfully MBBS course from JJ Hospital, he did DNB from National Board of Examination in 1987 and AFIH from CLI, Mumbai in 1997. In and soft nature, like a son who have proud for rising in the morning and setting in the evening. He was a senior faculty for ADIS Industrial Safety course of MSBT for last 24 years in the subject Industrial Hygiene and Occupational Health, and has taught over 650 safety students. Honorary Assistant Professor Surgery at Vedanta Institute Medical Science, Dahanu, teaching in his passion, and he has till date delivered more than 1200 lectures and medicine in journals Boisar. He has 2 international journal publications on industrial chemical burns to his credit as a first author. His poster presentation was recognized in WHO World Health Organization Safety Conference held in Singapore in 2017. International presentation, till date he has delivered 4 dies and 3 posters presentation internationally on chemical burns in the country like Sweden, France, Singapore, Malaysia, Sri Lanka and Spain. His research on industrial chemical burns continues till date. To come at the dais and start the lecture. चलो give a big claps, जोर तालियां बजाइए. सर अब बढ़ जाओ.
Is going to be on some of the work permits and the health issues which are associated with it, and these are very practical things which I am going to speak to you and tell you about what is going to be the health hazards in working in the various areas on the shop floor when we are doing various operations. That time there are various health issues which are associated with it, like working on the height, one. Second is working in the confined spaces. That is another thing where what is the health hazards which are going to be there and what is the precautionary things you have to take, as well as what are the prerequisites of allowing a person, that is giving a permit for a person to go into working into height or into the confined space. Similarly, there are other things which are there, like working in the hot work area, or working in the hot work area, or working in the cold room, in the opposite side working in the cold room. There are certain things like certain operations are carried underwater also, maybe not in our MIDC, but many places where underwater constructions and things are going on, there also what are the precautions. So, what are the precautions? And lastly, we are also going to see what are going to be the health hazards for working in the noisy areas which are going to be more than 90 decibels, which is a permissible limit. So, let us start with first working at height, because that is the most important thing. Now, you know, working at height is a lot of fatalities occur and the serious injuries occur, like falling from the ladder, scaffolding which is there, roofs. So, other than that, of course, when a person is working on the height, that time he is carrying lot of equipments, instruments, and if proper equipment, instruments are not being kept, then falling objects, fragile surfaces, unstable equipment, all these can cause the problems. Key risks involve the equipment use, poor edge protection, and also the various weather conditions in which the person is working on the height. So, all this we are going to see about working on the height. First and most important thing is what is the working on the height, and the basic criteria you must know is never allow a person to work on the height more than 50 years age. That is what is internationally accepted, that above the age of 50, however fit he may be, we are not allowing above 50 years age. So, that is the first criteria as far as the age is concerned. Second thing is, the working on the height can cause the fall from height, falling objects, slippery surfaces. Many times when the person is working, the surface might be slippery due to the oil or grease or whatever things which are using. So, slippery surface is another thing. Then working on the height, there can be unguarded openings which can cause the problems, fragile problems. So, these are various things which are the working on the height, what are the various things that can happen. That is the platform associated with the L&T, which was doing the construction of the 3rd and 4th reactor at Tarapur, and we had done a research that time, and the harnesses which were, so that any falling objects or the things are happening, then the persons who are there below should not. And the second is the physical part, at the 10 feet height and with a sort of thing to, is going to be for only 6 months. Is going to be for only 6 months, because every 6 months the health issues change, and that is why you may be feeling such a thing, like you have gone to, Mahabaleshwar or Matheran or somewhere, and you go on, that is what, and you go on, that is vertigo is the chakkar and giddiness is the vertigo is the chakkar and giddiness is the giddiness is also chakkar, but with the darkening coming in front of the eye. Not allowed to work on the height, then he is not allowed to work on the height. Most important thing is the history of convulsive disorder. Now, this is very difficult to elicit. Of around 20 years also, where the person has gone without fits and then the person gets fits. Now, if he is having the history of convulsion taking it, so it is not possible. So, what is the normal thing what we do? What we do is we ask him whether he is put on any, he is taking any tablets. That is the best way of asking. Now, asking him whether he is having any, taking any tablets. Now, normal being on the height, but if uncontrolled blood pressure is there, that person being on the height. But if uncontrolled blood pressure is there, that person is having blood pressure, but when we check the blood pressure before going things, people are doing fasting in the in India. So, many times you find that patient will say, "Aaj mera fast hai." So, if class who are doing the height work and other things, but you have to see whether he is under the influence of alcohol that time, and whether any things that we have to see. Just don't go on ticking. Please ask the patient whether these things are there or not. In medical things we are there. Then another thing is the overweight. Now, these are the things which are medically done. So, hearing, vision testing, that is there. So, he is able to hear if somebody shouts from below or some at least from a hearer, is what is known as the nystagmus. It happens in many cases. When you do the head thrust, you find that the eyes are going vibrating and they keep vibrating like this. So, that is what is flat foot persons should not be allowed to work on the height. But actually there is, we are already having the shoes and other things, the safety shoes or the shoes which are 1 minute, within 1 minute he falls down, that is Romberg negative. We do not allow against such person. So, very important is just make him straight hands and close the eyes. Many times the patient will fall. So, that you must see also. This is the extended Romberg. Raise, just make the hand straight, let him balance on the hand and keep the foot one after another and try that. That is the extended Romberg test which we try. Head thrust, I told you, head thrust is just to see whether he is able to have the eyes going on this nystagmus, what we call eyes. So, that is another thing where we do not allow the patient to go on the height. Then the next is there are Utterbecker test and Halifax test. In that, what we do is ask the patient to walk with the closed eyes. He is able to walk in one line or not. Close the eyes and ask him to go 5 steps like this, 1, 2, 3, 4, 5, and just come back again. So, if he is able to do that, then it is normal. So, these are the certain quick tests which you can do even in the factory also before this, that if you are suspecting that these are the things, just ask him like this Romberg test, or ask him to stand straight, ask him to go with the eyes closed and see all this. So, these are the things which we see for going on the height, unless you have to make. Of course, vision test and audiometry is for the vision testing and the ear testing, so that his hearing is perfect. So, these are the medical things which we see in the working on the height. So, I have explained you what are the medical things which we see. Then of course, the second thing is walking on the structure. Walking on the structure, 10 feet height, 1 foot long platform, and he is able to walk with the harness, of course with the open eyes, and then walk and come back properly. If he is able to do that, physically he is fit enough to this. Pulse rate we check before going on the 10 feet structure, and pulse rate after coming. There should not be a difference of 10 beats. 10 beats if it is 80 and 90. We are trying to have this structure. We have got it in the BRC and TAPS. So, there when we are doing lot of work, that we are checking that. Here we do not have it, but I think we are trying to have it here in TIMA. If we can have it, then all contractors can do that, and I think we should praise for this year. It is a very simple structure which can be constructed by any erectors, and everybody can take advantage of that. Let us see if we can put it to TIMA and see this. So, this is about working on the height. Any questions are there? Otherwise, we will go to the confined space things. Medical, any questions which are related with the working on the height, what I have explained? Otherwise, we go to the second part, and that is the working on the confined space. You are afraid to go in a guha or inside, that is what is known as the claustrophobia, fear of going in a closed thing, that is known as the claustrophobia. If person is having claustrophobia, please do not allow him to work on the, that is the first thing which is there while working in the confined space. Let us see what are the problems of working in the confined space. In the confined space, the potential hazardous atmosphere can be there, because oxygen restriction is there. Hawa kam hai, so person will be having a deficit of oxygen. Unless there is a proper ventilation or a oxygen line is provided, then in the confined space there can be a problem because of the hazardous atmosphere. Low oxygen levels. Normally the oxygen levels in the atmosphere are, anybody? 21.7. Okay, 21.7 in our atmosphere at sea level, 21.7 is at the sea level. If you go on the height, of course, it will be a oxygen levels will be less, like in working in the Baddi or Simla and all that areas, the oxygen levels will be less. But at the sea level, atmospheric, this is 21.7% is the oxygen. So, that is there. Now, if the oxygen level drops in the confined space to 19.5% to 23%, that is what is the that should be the optimum levels, 19.5. It will be less in the confined space, but it should not go below 19.5%. So, 19.5% is in the space, it should not go, oxygen level should not go below 19.5%. Then the toxic gases, of course, if the person is entering into the vessel or into the closed chamber, then we must see what are the gases that is there, what is the vessel used for. Many times we have to see what is the TLV of the area gases inside the vessel or in the closed space. So, toxic gases which are there, like hydrogen sulfide or carbon monoxide, if the person is entering into a sewage line, then it can be methane also. So, or hydrogen sulfide in the sewage, closed sewage line. So, there we have to see whether it is not exceeding this. Hydrogen sulfide TLV is 10 ppm. Then carbon monoxide what is the TLV of carbon monoxide? 100. Okay. So, this certain TLVs we must know if we are going to be working in the areas. So, that we must know. So, what are the toxic gases which should be below the TLV level? Other than the toxic gases, inflammable things, because if you are going to carry out any hot work inside the vessel, you are going to have some welding or something to be done. Then we must see that the gases are not, whatever inside is there is not inflammable, otherwise it will cause a fire and another problem. So, inflammable gases level and toxic gas level should be there. Person going in the confined space, claustrophobia I told you. First thing, he should not have any fear of going in the closed space, which is where he is going to be. Next thing is the visibility. Visibility is very poor in the closed space. So, there we have to see that the person's vision is proper, or he is wearing the proper refractory error spectacles, whichever is there. Of course, safety goggles is different, but he should have his own vision should be proper also. That is what is the vision testing. Hearing testing is also there. Vision and hearing is very important, because he should be able to hear the call what is there. Now, last thing is about the psychology of isolation, that is working in the closed space. The person for a long time, how much time he is going to spend in the closed space, that is also important, because then psychologically he can have the problem. If you are going to work for a longer period, then person can have the isolation, and fear of isolation can be there. So, psychology of isolation should be also judged. Then next thing, so what are the things what we examine for the medically, what are we going to see for the person working in the closed space? One is about the conditions which are there. Of course, this is what we saw: oxygen levels, toxic levels, inflammable levels, other things what are there. Then person, as far as person is concerned, he should be having a proper cardiovascular and respiratory fitness should be there. That he should be able to breathe properly, and he should be having no respiratory problems or something. If he is having URTI, he is having cough or something, his khasi hai, pehle se hi khasi hai, bimar hai, so don't put him in the confined space, because that can cause further problems as far as his breathing is concerned. So, proper PPEs are very important, like gas masks or whatever SCBA or whatever you are going to provide for working. That is the second thing which we are going to do. See that the proper oxygenation is given. Ventilation or the oxygen supply tube to the mask. So, he is having supply of oxygen or proper ventilation in the area is very good. Safety harness, if it is going down in the confined space, like, so then safety harness is very, very important, because we should be able to bring him up also, if in case he falls down or in case he gets giddiness and due to the breathing problem occurs. Lifelines are very important. So, designated attendant outside should be there. Whenever the person is inside in the confined space, one dedicated person should be there, designated to be outside as an attendant. So, this is what is a permit, and of course, if the hot operations are going to be there inside, then we will be seeing about the hot operations, what is going to be the additional things which will be in the confined space. So, these are the things what are medically required to be in the confined space. So, other than that, of course, the blood pressure and the other things like whatever tablets or he is taking, you should ask him whether he is taking any medical things as for in the routine use, that you must be able to elicit from him if he is having any giddiness or other problems. So, these are the things which are there for the confined space. Then we will go to the next one. After confined space, we are going to see working on the height, then the confined space we are going to see. लैपटॉप थोड़ा हैंग हो गया. Then thing what we are the hot work permit. So let us see what is the hot work permit. What are the things what are to be seen in the hot work permit areas. Normally hot work permit areas where the welding is taking place or any operations where the fire is going to be there or sparks are going to be there. So, those are the hot work areas. Generally it causes the sparks, flames, heat that is there. So, the problems is because of one is exposure to the ultraviolet and the rays to the eyes, and the second thing welding gases, the inhalation of welding gases, and the third important thing is about the fire and the heat problems, working in the heat issues. So, injuries, fire explosions, these can be the problems in the hot areas. So, what are the things what we see? So, combustibles or whatever fire can whatever can cause the fires, we have to keep the things away at the distance of at least 35 feet. What is recommended is 35 feet distance is recommended. Whenever the operation is carried out for the welding or something, at least in the circumference of 35 feet, there should not be any inflammable thing or in the any combustible thing which can cause the fire. Proper exhaust ventilation is there. If we are if the hot operation is being carried out in the closed space, then proper ventilation is very important, because exhaust fumes should be taken out. So, exhaust ventilation is very important. Proper PPEs for welding, like wearing the shield, face shield for the eyes, and the eye goggles or the proper eye goggles for the welding goggles or the welding face shield should be proper, and gloves also should be there in the hand. So, these are the whatever the person is putting from the as a coat for the welding purpose. So, proper PPEs are required for the welding in there. Fire risk is there, explosion risk is there. So, these are the things. What do we see in the medically? Medically, what we see for working in the the hot areas, one is about his condition, physical fitness should be there, eyes should be proper, eyesight should be very proper, and the vision, the distant vision and the near vision, both has to be checked properly. So, these are the things which are there. Fire resistant clothing, PPEs are very important for working on there, and insulation of the mats or the platforms, insulation of the mats and the platforms which should be there to prevent the electric shock in the wet conditions. So, that is which are which we have to see. Electric current and should not cause any electric current problems or electric shocks. So, this should be avoided, this should be looked into properly, as well as for the eyes and the PPEs which are there. Now, what happens when the person is doing welding? He is inhaling the fumes also. So, respiratory condition is very important, that he should not have asthma and the breathing problems which are there. So, medically we see about the respiratory conditions and the vision, which is very important for the hot work permits. So, welding, arc eye, cutting, burning, what are the common hot work operations? Grinding or drilling, So, that is another thing. Spatters can fly off, and cause injuries in the foreign bodies in the eyes. If the proper covering is not there, then it can cause. Then it can have problems of burns on the skin also, if the things are flying off there. So, what metal is used is suppose the metal used is the chromium or something, then it is very difficult to remove from the skin. So, that is another thing which we have to see. Soldering, brazing, heat treating. So, all these are the various operations which are carried out in the hot work permits. So, fire and explosion caused by the sparks, slags igniting surrounding material, toxic fumes, gases. Mainly what happens is the nitrogen oxides and the carbon monoxide, nitrogen oxides and the carbon monoxide, that is NOx gas and the carbon monoxide CO. Then physical injuries from hot metals, burns. Another thing is the heat and the dehydration. So, while working in the hot areas, we have to see, especially in the summer season, we have to see that the person is not suffering from the dehydration. So, frequent drinking of water has to be allowed, the operation has to be stopped, and the person must keep on drinking water lot of there. So, he does not go into the dehydration which is there. Other health hazards are of course heat hazards which are there are because of the heat, like too much of heat can cause the skin problems, then patient can have giddiness and chakkar also. If too much of heat is generated, then person can have sweating, lot of sweating, dehydration, and the skin problems can be there. So, these are the various things in the hot operations and the high temperature areas where we have to see. Then after the hot work, what we are going to see is about the cold room which is there. While working in the cold room, specialized PPEs are required, layered clothing, thermal gloves and insulated. Non-slippery boots are very important. While working in the cold room, non-slippery boot or the footwear should be proper, because there can be a problem of slippery surfaces in the cold room, and non-slippery footwear is very important. Hypothermia can cause the problems, that person can have hypothermia is the temperature of the body going down below 96 degrees centigrade, 95, 96 degrees Fahrenheit. If it is going down, then it can be called as a hypothermia. So, that is what is there. Oxygen deficiency can be there if the room is closed one. So, we have to monitor about the oxygen deficiency also. Cold stress, staying for a long time in the cold room can cause cold stress. That is another thing which is there, cold stress, like heat stress which is there, cold stress can be there, and it can be a psychological condition where person can have problems while working there. Another thing is cold rooms are usually dark, so the lighting should be proper, otherwise the eyesight problems can be there in the cold rooms. Then key safety and operational procedures, that is the PPEs which are there. Cold stress prevention should be there, person should be given the break of at least 20 minutes in between 1 hour, at least that should be there. Every 1 hour that should be a break of around 15 to 20 minutes to come out, at least break in the sense he has to come out of the area, and that is what is the prevention of the cold scheduled breaks which are there. Then another thing is frequent drinking of water is also important. In the cold rooms, the person can become thirsty actually, and so he has to come out. Then oxygen depletion can be there, so fresh air should be given. So, that is the reason why you give the breaks in between, and then operational lighting should be proper. The health monitoring, what we normally do is about the numbness and the whether vascularity of the extremities. The cold extremities can cause the problems, and their vascularity of the extremity. How do you check the vascularity of the? Just see about the nails, by doing the nails blanching is coming or not. That is a very easy way of saying that the blood supply to your fingers is not being. Cold room can cause the fingers to become numb and the blood supply can stop. So, ideal way is just press on the finger and see on the blanching whether the blood is properly blanching or not. So, warm drinking water, hydration, fluids should be provided in the cold room. So, these are the various things which are there in the medical part as far as the cold room is concerned. Then another thing which we are going to see hot this cold room, then we are going to see is about working below the water, underwater. That is another area where we require to be properly. Underwater, that is there. While working, some operations which are carried out underwater, normally in our MIDC it may not be there, but we have seen this underwater problems again while the 3 and 4 construction was there, and Gammon India was doing a platform of releasing the hot water from the 3 and 4 reactors into the sea. There was a big tunnel to be put in the sea pipeline to be put, so that the exhaust water, warm water is thrown in the sea, that is there. So, the many of them we have seen that time what are the problems of those divers and the other things who are working underwater. Biological hazards of course are there of the sea, jellyfish and other things causing the allergy to the skin, and sea water can cause the allergy to the skin, that is of course there for the underwater in the sea whenever the things are there. But it can be otherwise hazards which are there in the high are about the construction part which is going on underwater, and things like platforms and other things which are constructed like your Bombay High or something. When the oil drills are constructed in the water, they have to go below and do the construction also. So, those are the things where welding and structural repairs and these things can cause the problems. So, working underwater is also there, and there we have to see about the breathing, that is the respiratory system, the eyesight, then the blood pressure and other things should not be there. Another thing what we have to see is going underwater is what is the depth to which the person is diver is going to go, because as the person goes down in the water, the pressure starts rising, that is the pressure on him. Now, what is the pressure? Atmospheric pressure which is there. So, that pressure goes on increasing as the person goes down into the sea water, that is there. When the person is in the submarine, it is a pressurized chamber. So, if the diver is there, it is going to be a pressure on him, because he is not in the pressurized chamber, he is just having the oxygen mask and then he is going down in the area. So, pressure can cause problems. What is the pressure problems? What we call as the Kazan's disease. There the nitrogen bubbles out, the nitrogen which is there in the body starts bubbling out in the bloodstream, and these bubbles of nitrogen can cause problems, like person can have a stroke also, person can have a heart attack also. Bubble acts like your clot. What happens in your heart attack? You have a clot in the blood vessel. So, similarly bubble can cause the blockage. So, these are the problem which can happen, what is known as a caissons. So, working in the depth is another problem, is about the nitrogen levels which are there. So, that can cause. So, working underwater, it can be risky, and that is why we should have either a remote operated vehicles or automated underwater vehicles, pressurized chambers which should be proper. So, that is another thing about the underwater working. So, these are the various things which are there when we give the work permits in the various areas which are there. What are the work permits for working on the height, for working in the confined space, that is closed space what we saw, then working in the hot areas, working in the cold areas, working in the hot water in the underwater areas. And last thing we have to see is about the working in the areas noisy levels above 90 decibels that is there. Of course, we have to see that about the PP is 90 decibels. You have to give the allowance, that is if the person is going into the noisy area where that is 94 decibels, then you have to give 2 hours allowance. The allowance there 90 decibels is for working for 8 hours, in the maximum allowed is 8 hours that is there. So, the time weighted average TLV of noise is 90 decibels for 8 hours working. So, you have to reduce the time interval which is going to be there in the person is going to work for 6 hours only, if the area is having 92 decibels. Of course, PPEs are important. The when you are wearing the muffs and ear plugs usually reduce by 3 to 5 decibels only. Ear muffs reduce it up to 5 to 10, maximum 5 to 10 decibels it can be reduced. So, that we have to see that the proper PPE is worn when going into the noisy areas which are there. So, that is about the noisy areas, and of course, the audiometry and other things we have to see. The control measures, if we can reduce the noise control program, that is checking the noise levels with noise sound meter or sound meter, and seeing that proper machinery is, we can reduce the noise, closed machine, closed chambers, if we can have. Ramesh,
Sir, I wanted to ask one questions which is practically we are I think most of us are facing. Wherever there is work, this is a challenge always we are facing. In suppose 5 people come and suddenly we want to get it tested. How to get it tested and frequently, and in one test all these tests should get covered. Is there any scope for that? Thank you.
See, work permits, we have already got we have made the drafted out already the work money or whatever. You can first only filter the certain things. So, that I can also give you that initial filtration also you can do it. 10 लोग आया उसमें से एक आदमी को एक आँख से दिखता है. Which I wanted to put it across to Tima, and we can have a structure here. It's very easy to have this structure. It's not going to be very costly. Any structure, and see if we can have. We have got enough space here in this. We'll put it to LG by, or even we'll put it to our Raut Saab also, and we can have a structure satisfied with that. So, it can be done. It's not a very big thing. Okay.
For confined space, what is the minimum voltage of the lights required to work inside?
What is the
minimum voltage of hand lamp or lights?
Light.
Yes.
See, visibility should be there. Visibility should not be. Medical checkup we are already doing.
टीमा चेयरमैन रवि साहब जोर तालियां बजाइए. Ready? Hello. Vote of thanks. Today, Dr. Parag Kulkarni has given very details